What you think, like what kind of factors contributed in the success of these initiatives, especially in terms of the cost effectiveness? So over to Javed sir.
To just specify 3 points you just mentioned and asked from me, that is, first of all, how this model is working and how PPHI was brought in to rejuvenate, to reactivate those underutilized, unapproached health facilities. The second one is factors. Third one is cost effectiveness. So I dilate upon first one, that is how PPHI did it. Basically, it again is a success of the model, that is the PPP model, which internationally once it was applied, that since government sector is always stuck up with its inherent flaws, that is of red tapeism and many other issues, that was the reason to brought in a new idea whereby combine the good points of both government sector and private sector, and to start to give the better services. Likewise, particularly when PPHI was hired by government health department on the lines of other provinces. So it was again, when we say it was how PPHI addressed the basic inherent flaws which were there, like where there was no posting of staff, health facilities were abundant, nobody was here to address them. So here comes the solution, that since PPHI was a private organization, it has a freedom to hire people, freedom to use finances, which generally are stuck up with so many rules and regulations in government sector. So here basically lies the success, that once you introduce a company, introduce a private organization which is free to do anything, keeping in view the situation. So success basically lies here. So like other organizations, like in other provinces, everywhere in the world, PPHI did it very efficiently, and I do contribute this to our pioneers of PPHI. Though there were so many problems, because when you are going to change anything, there are always change resisting factors. So within the government, there were so many change resisting factors, there were fights, there were so many issues, but somehow there was brought in. So it was again, once it was not like a PPHI was introduced in all the provinces. It was first model and was piloted in district Kashmir, where so many huge, serious level of issues were brought in. You understand Kashmir is a very tough district. So slowly and gradually, after observing the performance, after looking at the satisfaction level of people, of health department itself, government of Sindh itself, slowly and gradually, it was basically the success rate which and satisfaction of people, and people being given their primary health care at the doorstep at a minimum cost, that slowly and gradually the compass was increased, and more districts were given to PPHI. So it basically is, when we say about how we did it, we just did the basics right. There was nothing miracle we did. We just did the basics right as far as this providing easy access to healthcare facilities are concerned. The second aspect you just asked, that is the factors. There were so many multiple factors. As far as there are certain peculiarity with the model, with the arrangement of PPHI and government of Sindh. Peculiarities in a sense, it is a bit different from other PPP models. Generally, in PPP model, the company or the enterprise which is on the other side do some. Most of the time, they do have certain profit motives, their organizational and other motives. But here, it was a different type of arrangement, where initially government of Sindh supported PPHI to get its existence. It was basically government of Sindh and health department which made certain lines on which PPHI will be formulated and established. And primarily it would be a non-profitable organization. The chief characteristic is it's a non-profitable organization, which I think where lies the success of this model, because here Nobody is trying to save money at the cost of the treatment, at the cost of saving medicine, patients. Like as Ibrahim Saab just discussed about the model of, I will not take the name of the organization, but initially 100 plus health facilities were just given under PPP model to that organization. But again, profit motive was there, and subsequently it failed. As far as PPHI is concerned, it, alhamdulillah, has keep on nurturing after its inception in 2008-9, and then it was made in company in 2014. More and more health facilities have been given to PPHI, and last year PPHI also stepped in the secondary care. We were given 3 THQ hospitals at Larkana and 5 RSCs. So the satisfaction level of the government shows that these are the factors. And again, when we counting upon the factors, another factor is that we have a very hybrid model, which again is the success of PPHI. That we do hire people, our HR from private sector, and at the top management, we have people from the government sector, which are basically from the superior services, the top level, which do basically come from through a competitive process. So here again, this is another factor which basically made PPHI successful, and continuous contribution also. And obviously the role of health department is key into that. I will always say it is a basically commitment and will of the health department that they kept on encouraging, supporting PPHI, and ultimately we have got this destination that we are managing around 1,350 plus health facility of government satisfactorily with a minimum cost given. Finally, coming towards cost effectiveness, yes, I would just refer probably that again study was arranged with the support of World Bank, Thinkville organization, and Gates Foundation. This cost effectiveness idea was piloted, was just analyzed at Tandova IR district. So I can share figures with you, but again, having major chunk of health facility, the Tandova IR, PPHI is getting much lesser funds than DOH at Tandova IR. This is just, I think, a brief statement I can say about the cost effectiveness, that with the minimum funds, and obviously this study and one of the DLI and this NHSP program is also to understand this fund flow arrangement and financial, to make this financial arrangement most effective. So here also, once we just have figures of Tandova IR, once we step in, we get the figures of other districts, then we'll be in a better position to understand. I don't claim right at now. I hope World Bank or those that are doing the study will be in a better position to tell the figures and cost effectiveness of this PPHI PPP model, introducing the PHC level.
Thank you, Javed Saab.